So we do unfortunately have a fourth positive case, which has come back positive for a resident of the Central Coast. This case is a close contact of someone that was linked to the Avalon cluster. So both the third and fourth cases are both linked to that Avalon cluster, and were both close contacts of people that contracted COVID. I'd really like to thank the two individuals, because as soon as they were contacted by the contact tracers, they self-isolated, got tested, and have been isolating for a number of days. So they've done the right thing, not only for themselves, but also the community.
So effectively, you're saying they're out of circulation in the community, is that correct?
Correct. Our contact tracers obviously have spoken with them further to see if they have been out and about, but they've been in isolation for quite a period of time now.
Right. Well, the big question, of course, is what is your advice and health's advice for New Year's Eve, and what are the new regulations?
Yeah, so the first thing that I really need to reiterate to people is, if you have any symptoms, so a sore throat, runny nose, cough, fever, please do get tested. We've increased our testing clinic hours at both Gosford and Wyong with the public health system, so they'll be open from 8 in the morning till 6. You can go onto our website or Facebook page. There's a phone number where you can book a time, or you can turn up. And there's also been an increase in clinics out in the community as well. In terms of the advice for the community, so a new order for Greater Metropolitan Sydney, including the Central Coast, will come into effect from midnight tonight. In effect, any public gatherings, so this will cover New Year's, but also for the foreseeable future until any other announcements are made, that they need to be limited to 30 people at maximum. And with that 30 people, that also means that you have to also physically distance at 1.5 metres, use good hand hygiene, etc. In terms of people coming to your house of residence, the maximum number of people that you can have coming in is 5, on top of the normal residents that are there. Once again, if people are coming to your house, I'd encourage people, if possible, to sit outside, because you have much greater ventilation and circulation of air, which reduces your risk, but also the need for, once again, maintaining that physical distancing, a use of good hand hygiene, and if you're coughing, sneezing, etc., make sure you do it into your elbow. They're the main sort of things I really want people to take heed of. I would reinforce, though, that it is important to keep checking on the New South Wales Health website, because obviously, depending on how these things evolve, there may be changes in what is put in place. But this is the most up-to-date information we have at the moment.
As far as the Central Coast is concerned, we've had a remarkably few cases, really, since for 6 months or so. We're reflecting about this. Why do you think that the coast has been relatively, I suppose, shielded from the main activity that's happened in Sydney and elsewhere?
Yeah, look, I think obviously up until this cluster occurred pre-Christmas with Avalon, the whole state had been going very well. And things were starting to get back to a bit more of what we were used to pre-COVID. I think that we can't be complacent, though. I think people have been very respectful of each other and have followed the advice that's been given. Hence, we've been able to maintain where we have been on the Central Coast. But it is important that this is going to continue for a while longer yet. Hopefully vaccinations will commence in March, and so people on the Central Coast will have that access, and that will be an approach where people obviously at the highest risk, so the elderly, healthcare workers, etc., will receive the vaccination first. But it will take an amount of time to actually roll out the vaccine. And even then, we're going to have to see how that actually goes over that period of time. So we're going to have to maintain that good hygiene practice and physical distancing for a bit longer yet.
Finally, what is your advice as far as masks and other hygiene is concerned for people?
Yeah, so once again, if you are in enclosed spaces, I would be recommending people to continue wearing masks. But once again, maintaining that physical distancing at the same time and good hand hygiene. And obviously, if you're in that enclosed space, it's really important that you're wearing a mask.
And I saw mention that perhaps the testing locations will be open on New Year's Day. Is that correct?
That they will be. So that basically from tomorrow morning for us in the public hospital sector, we're increasing the hours from 8 till 6. They'll be open every day up until the 3rd. We'll reassess then the hours that we need and potentially the need for any further clinics. And also, as I said earlier, there's a number of providers out in the community who are also increasing the clinics that are available. So I'd recommend people going onto the New South Wales Health website. You can actually, there's a good map which shows where those other clinics are as well, and you can see what clinic is closest to home for you.
All right, well, thanks for speaking with Central Coast Newspapers.
Not a problem, David. Take care.